There are signs now across Canada that we are starting to see a new wave of COVID-19 infections. In the week of August the 15th, public health officials reported an 11% increase in COVID-related hospitalizations compared to the week before. Joining us with a closer look at where we are now, infectious diseases specialist Dr. Isaac Bogosh is joining us this morning. Good to see you this morning.
Good morning, Lindsey.
Are we at the point where we can view COVID as a seasonal sickness like the flu?
I mean, there certainly are seasonal components to it, but we know that this really is an infection that occurs year-round. Some parts of the year, there's more of it. Some parts of the year, for example, in the summer, like this summer, there's less of it. Whereas in the flu, there's parts of the year where we're really seeing zero flu cases. So unfortunately, COVID will wax and wane, but it just seems to always linger in the background.
Only 5.7% of Canadians got a COVID booster shot in the first 6 months of this year. Does that concern you at all?
Oh, certainly does. I mean, I think the key thing here is to focus on those who are most vulnerable to severe infections. And we know who those individuals are. We know those tend to be people on the older end of the spectrum, people with underlying medical conditions, putting them at greater risk, those who reside in long-term care facilities and retirement homes. And it's extremely important that those individuals are up to date on their COVID-19 vaccines, including their boosters, because quite frankly, those are the groups who are overrepresented in hospital. And sadly, those are the people who are more likely to have severe manifestations like hospitalization, ICU stays, or even death.
For those people who are not in that most vulnerable category, do they need to get a booster? And if so, when?
Well, it's important to listen to the National Advisory Committee on Immunizations, and they haven't actually come out with their guidance yet. We know there's going to be a booster vaccine campaign in the fall, probably sometime in mid to late September. We know there's an updated vaccine that's going to emerge around that time. And I think let's wait and see what they suggest. But I remember in their for example, summer communications, they explicitly mentioned groups who are at greatest risk for severe infection and how important it is for them to receive that vaccine when it rolls out.
You know, speaking of rolling out, we're about to enter the fall months. School's about to start. Does the healthcare system face the same threat of being overwhelmed as it did in the early years of the pandemic?
No, it doesn't. It doesn't. Listen, let's not pretend for a second that our healthcare system is doing well. It absolutely isn't and needs a lot of tender, loving care and support. Having said that, you know, in 2020 and 2021, our healthcare system was overwhelmed with COVID-19. Okay? And a single infection overwhelming our healthcare system. Now our healthcare system is, of course, stretched, and of course, COVID is contributing to that. But I don't think we're going to see scenes like we saw in 2020 and 2021, where provinces were running out of intensive care unit beds, and we were bringing healthcare providers from other provinces in to help out. We won't see those scenes based on the variants that we're seeing circulate now. Obviously, you have to keep an open mind that different things can happen down the line. But based on what we're seeing now, these waves will look much like waves that we saw in the 2023 and late 2022 calendar year.
If I get a cold, should I be doing a test?
Yeah, I mean, if you have rapid tests available, I think it's really helpful. Obviously, I think the most important thing if people feel sick is to stay home. And if people's children are sick, the most important thing is to keep them home from school, regardless of if it's COVID, if it's influenza, if it's RSV or something else. Don't go out and get other people sick. It is helpful for testing in some situations, I think, especially if people have risk factors for severe infection, and they could be a good candidate for a medication like Paxlovid, which keeps the highest of high risk out of hospital and prevents more severe manifestations of the virus.
Well, Dr. Isaac Bogosh, good to see you. Thanks so much for joining us this morning.
Have a great day.
You too. All right.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.